Hi, I'm Dr. Roper from the Department of Radiology. The reason you're here is because your doctor has asked us to do a study to check and see how well your heart is working. Over the next few minutes, I'll be explaining this test to you. You will have the opportunity to ask any questions you may have at the end of this recording. To understand this test, you need to understand a few things about the heart. First, the heart is a muscle that requires blood to pump effectively. Second, the way the heart muscle receives blood is through small arteries on the surface of the heart, known as the coronary arteries. Third, these coronary arteries can become diseased and narrowed. When this happens, not as much blood passes through the artery as your heart needs. Fourth, heart muscle that does not receive enough blood becomes damaged. This can cause chest pain known as angina. Fifth, if heart muscle goes without blood long enough, the muscle dies. This is known as a heart attack or an infarct. Today, we are going to test your coronary arteries. To do this, we will first inject a medication that stresses your heart. If you have normal blood vessels, those blood vessels will dilate to allow more blood to go to the stressed heart muscle. If the arteries are diseased, they will not be able to dilate properly. Next, we inject a small amount of radioactive medication that is absorbed by your heart muscle. Don't worry, the dose of radiation is very small. Heart muscle that gets blood from normal arteries will absorb a lot of this medication. Heart muscle that gets blood from a diseased artery or heart muscle that has died as a result of a prior heart attack will not absorb much of the medication. Finally, we use sensitive cameras to make a 3D image of your heart, showing us what parts of the heart have absorbed the radioactive material. We will also see how effectively the heart is pumping blood. We look at the images shortly after you leave the scanner to determine whether we need to bring you back for additional images tomorrow. If we do need to bring you back, that does not necessarily mean that the test is abnormal. It just means that we want to compare images of the heart with stress to images of the heart without stress. There are risks associated with this procedure, just as there are with any medical procedure. The main risks are the side effects of the medication. These side effects are temporary. They last only 2 to 3 minutes. They can include headache, a feeling of rapid heartbeat, shortness of breath, chest pain, stomach pain, nausea, and other symptoms. As I said, fortunately, these symptoms are temporary. They will resolve within a few minutes. If these symptoms become intolerable, we can give you another medication that turns off the stress medicine. However, if we do this, our test is not as effective. So if you can endure the symptoms for a few minutes, the stress test will be better. It would be extraordinarily rare for something more dangerous to happen during the test. Therefore, we will be monitoring your heart rate, blood pressure, and EKG throughout the test to ensure that if something does go wrong, we can take care of it immediately. However, I again wish to stress that the risk of something serious happening to you is very low. You could reasonably choose not to do this test and instead perform a treadmill stress test if you are able to walk for about 15 minutes on a treadmill. There are also more invasive procedures available to directly test your coronary arteries. However, your doctor has recommended that we perform this perfusion study as the lowest risk option. More invasive and risky procedures would need to be discussed with your cardiologist. As with all medical procedures, performing cardiac stress tests is not an exact science, and we cannot guarantee the results of the procedure. Kaweah Delta Medical Center will maintain images, as we are required to do by law, but we will not share your information without your permission. If you want a copy of your images for your own records, you can go to the radiology department and request one free of charge. Our goal is to provide you with excellent care so that you can return home to your family as soon as possible. We cannot perform this test without your permission. We will not force you to do it. In a few moments, we will give you a form to sign asking your permission. If you have any questions, please ask the nurse or the physician from the radiology department. Thank you for your attention.